So with all of these procedures that we're talking about in our surgical gymnastics and the prosthetic gymnastics that we do, in the end of the day, we're doing this for a patient, and the patient's got to understand the risk and the benefits, where we are with all of our science and where we are with our clinical documentation. And that really comes back to this issue of consent and the process of this. Is being in an educational institution, one of the things that we really try to strive for is to make sure that when a student is presenting care plans to their patients, that the patient understands the risk and the benefits.
Care plans instead of treatment plans. That's kind of interesting.
That
interesting
that because care plan implies there may be nothing needed. It all depends. The concept, though, is there are times when we know the science weighs one direction and that we want to encourage the patient to strongly consider it, but they may not be able to, for a variety of reasons, undertake what was recommended. And this is this process of informed consent. And I just would like, what are your thoughts in this day? If you have a patient come in your office here in New York City, you're going to unfortunately lose a tooth or a series of teeth. What is your process of how you discuss that in terms of the alternatives?
Well, the first thing I do is I find out if they're a lawyer or not. If they're a lawyer, we just kick them out. I send them to the Midwest.
Thank you.
But no, in all seriousness, it depends on the expectations of the patient. First, dentally, all our training is to know what we could save, and if we can't save it, what we can do to fix it, whether it be surgical, prosthetic, or a combination of both. But the real reality comes down to what is the patient's needs. Somebody, I do one case, and to me it looks beautiful, but they might see one papilla being a little short, and to them that's the end of the world. And it's not even a black triangle, it's just a little shorter than the other side. It's not even black. And it's driving them crazy. I mean, to the point. So you have to know who's in your chair. You've got to listen. You've got to, as you know, you have to listen to the patient and find out their chief complaint and really listen to it. Just say, how can I help you? I always tell my students at school, I said, just how can I help you? And you walk into the office and don't say a word. And boy, then sometimes you got to draw it out. But once it starts to really come out. And just let them be a good listener. And you start to see that. And you got whatever you come across, you got to meet that chief complaint. And so many people forget that. And it's one of the most common mistakes that students make, that they don't really follow the chief complaint, or they do it the last thing. And as opposed to if they could address it early, they should take care of it right away, whatever it is, and then help them with the rest of their mouth. But as far as informed consent, depends on what the problem is. It's like, for example, a person who comes in with a denture, or you're edentulating the rest of their mouth. They're losing their last few teeth. I think informed consent today is certainly telling them that you should be mandated to have at least 2 implants in the mandible. Something like that, because although we can make a denture for them, and they might be happy with that right now, and they feel comfortable cosmetically, and it might be giving them what they need. We all know that you're going to get increased resorption of the ridge over the next 15 to 20 years, and we're going to have someone that's not so happy 20 years from now. I think it behooves us to tell them what to expect.
Okay.
And I think not just initially, but also down the road. And they should try to work towards that, even if they can't financially afford it all right now. They should try to work towards it, and we should try and build into our treatment plan. If we know there's a better treatment plan for them health-wise, and that's something like that will change their health, change their diet over the years, and so on, and as well as quality of life, it behooves us to tell them that, of course, and so that's a must. So informed consent is one of those big, broad-based things that depends on what they came in with and what their expectations are, what they tell you.